Lumbar disc herniation. Lumbar disc herniation or slip disc in the lower spine, it is a very common pathology. Lumbar spine is this part of the spine, the lower part of the spine, and it is very common to have a disc herniation there. Disc is basically like a jelly-like material between the bones of the lower spine. So if at all there is lumbar disc herniation, it can be painful. It can cause pain either radiating down the leg, that is usually called as the sciatica, or it can also cause localized back pain. Now, normally the symptoms of lumbar disc herniation includes pain radiating down the leg, which is known as sciatica, or there could be numbness and tingling in the leg. Also, sometimes there could be frank paralysis. That means some part of the leg is losing power and the person is not able to stand and walk. Or sometimes there could be symptoms related to motion urine. That means the person is having difficulty in passing motion or urine. Rarely, it can also lead to erectile dysfunction or sexual problems in males or females. So all these symptoms could be because of lumbar disc herniation. Lumbar disc herniation, it could be an acute condition or a chronic condition. By acute, I mean it could be because of some injury, some slip or some accident, where because of the injury or the predisposing factor, there is a sudden outpopping of the disc material and it starts pressing the nerve. Sometimes the leg pain or the symptoms in the leg are not very severe, but the patient is having back pain. It could be because the lumbar disc, the annulus part of the lumbar disc has ruptured. So if there is an annular tear or if there is a tear in the outer part of the disc, then localized back pain might be the main symptom. Now what happens over a period of time, this disc which herniates, if it continues to press the nerve, the patient may not be able to walk or do his daily activities because of numbness, weakness, paralysis or pain in the leg. So in those situations, treatments become essential. Now, normally the treatment of lumbar disc herniation includes 4 to 6 weeks of conservative treatment. Only in situations where there is weakness or paralysis or there is a problem in passing motion or urine, surgery becomes a must. But otherwise, in almost 97% of the cases, there is no need for surgery. And the patient becomes okay by just rest, medicines, physiotherapy for 4 to 6 weeks. In majority of the cases, almost in 97% of the cases, surgery is not required. So with rest exercises, medicines, some neuropathic medicines, the patient becomes okay and is able to go back to work within 4 to 6 weeks. In rare situations where the pain is excruciating or patient is having paralysis symptoms or symptoms related to motion, urine or sexual dysfunction, then only we need surgery for lumbar disc herniation. So normally the surgery which is done for lumbar disc herniation is normally a microscopic or endoscopic surgery, which is done through a keyhole technique with a cut less than 1 centimeter, and through that cut only we are able to remove the disc material without cutting the muscle or the bone. So it's a safe surgery if required, but in most of the cases, like I stated earlier, the problem can be very well managed by just rest followed by medicines, exercises and physiotherapy. Thank you.